Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now, so you can catch us via podcast. So if this is the first time you've tuned into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening here, not to me, but to these extraordinary guests that I get to have on the show. And today's no different. I've got a repeat guest. She was here almost exactly a year to the day. She was here on March the 17th, 2023, and here she is right smack dab in the middle of March 15th, 2024. Welcome to the show, Rebecca Duffy.
Thank you so much, Bob. Good afternoon. I'm so glad to be here again.
And for our listeners, Rebecca, tell us a little bit about the company you're with. I usually do the intro, so I'll let you do the intro for Evolved.
I love that. I love introducing our company. I am the clinical director of the Southwest region at Evolved MD. So we are a collaborative care partner in the Valley that brings healthcare, mental health care, right into your PCP office.
Wow. That is great because your primary care physician doesn't necessarily have that skill set or that clinical capability. So
right. And so what we say is we're coming in to relieve the pressure valve, right? Because your PCP is doing de facto mental health care on a daily basis. We come in and we trust our PCPs, especially the older population. Mm-hmm. So they're coming in and opening up and being vulnerable because for some of our patients, they've been with their PCP for many, many years.
Right.
So they will walk in and talk all about not only their physical health issues, but also their mental health issues. And so we, instead of putting up a barrier of here's a referral, go ahead and call your insurance and see, if we can get you in somewhere. It's my mental health professional, my behavioral health manager is in this office, and I'd like to walk you over to their office and introduce you right now. And that removes that barrier of access to care, which is really hard for Arizonans at this point.
Well, correct me if I'm wrong. It used to be 1 in 5. It's 1 in 4 now?
1 in 4.
1 in 4.
Yeah.
And it's 18 and over. Mm-hmm. Has a behavioral health issue.
Yes, and about 50% of Americans are having mental health issues at this point and not getting treatment for them.
Wow.
Right.
That's crazy. And a lot of them are probably self-treating.
Self-treating, right? And then I think, too, we have to talk about the barrier of cost, and that's something that we try to eliminate as well, but that's also an issue. Mental health care is expensive if you don't do it right. And if you're not able to collaborate. So the model just makes sense.
Well, and I think you hit the optimum word, collaborate, right? Mm-hmm. So this is a collaboration between you all, Evolved MD, and these primary care physician practices.
Right. And so what we do, again, that thought of collaborate, it just makes sense, right? So if I'm being treated by my PCP, and my PCP, again, is doing that de facto mental health care and potentially prescribing any kind of psychotropic medication, we should always be partnering that with a counseling style of service, right? The medication, there's no magic pills. We've learned that now. So what do we do to make sure that the changes that one of our patients make are long-term so that eventually they know how to deal with those things and we take away the probability of self-soothing?
No, that's really nice. And again, I mean, look, we've evolved.
Mm-hmm.
What a great name. And, behavioral health isn't so much of a stigma that it once was. I mean, back in the day, I remember my grandmother whispering in my ear, tell me not to get so close to so-and-so because he's a little,
Right.
a little, you know what. And I was like, okay. But I mean, we whispered about it and we didn't do anything.
Sure. And I think, the stigma has slowly been lifted. And as a counselor myself, I'm really proud of that. I think that's another thing that we look at, though, as well with Evolved MD is put our behavioral health manager right in your PCP office. So for those people that still do hold a bit of that stigma, they know I'm just going to my doctor.
Right.
Somebody that I've seen for many years that I trust.
Right.
Yeah.
So, all right, you're here in Arizona.
Mm-hmm.
How long have you been here now?
Going into our 8th year.
All right, and I don't mean to put you in the spot, but how many primary carers are you guys residing in right now?
Oh my goodness. Well, we have big partners across the state of Arizona. So Banner Health, Evernorth Health, Honor Health,
They're pretty
Optum
big.
Health.
They're pretty big.
And then we also are now since I saw you last, we're now still in Utah, but also in New Mexico and Colorado. So I would not venture to give you a number because it actually increases probably by the week.
So we're talking hundreds.
Mm-hmm.
Yeah. And being aligned with those medical practices and those facilities and those medical systems, because that's what we're talking about with Honor Health, and we're talking about Mayo and others. There's systems.
Mm-hmm.
So many of those systems have primary care practices attached to them, so that makes so much sense.
Right. And then, we also can gather some longitudinal data of the improvements that we're making in the community right here in Arizona.
Right. It really truly is making the primary care physician an integrated medical practice, right?
Yes,
because
absolutely.
We're talking about mind, body, and spirit.
Mm-hmm.
Because we constantly are working on the body, but we sometimes forget about the mind and spirit and how important they are.
Well, and one of the things we talked about as well last year, right, Bob, is the way that those two things affect each other in such a major way. We forget things like sleep, how much that affects your physical health. But if you're not falling asleep because you have major anxiety by the time you lay your head down on the pillow, we need to look at those things as intertwined.
Right.
We see a lot of patients with somatic symptoms, and those somatic symptoms being really just feelings and emotions being played out in the body. I can tell you as a clinician myself, but also as helping to manage other clinicians, I store all of my stress in my neck. Well, that then creates problems for me down the line because my neck is connected to everything else. And so I work through those things, but I have to be very conscientious. That's a small thing. But if I were to wake up every day with a neck ache that then caused me to have a migraine, that's a daily life struggle for some people. And maybe that's all due to the stress that they aren't able to cope with or process.
And then, you're medicating or you're self-medicating to try to cure that, when all you need to do is be able to manage that stress so you can take that pain away from your neck. And it's like a kinetic change, right?
Absolutely. It's a domino effect.
Yeah.
And that's what we're trained in, right? And we're bringing in talented master level clinicians here. This is not life coaching. This is real counseling right there in the doctor's office. And the other thing that Evolved MD does in our model, in this collaborative model, is bring in a psychiatric nurse practitioner or a psychiatric provider. They are not going to provide medications, but they make recommendations right to your PCP. So another fact in Arizona is the wait list for a psychiatric evaluation is about 3 to 4 months. That's absolutely off the chain too much, right? If we know somebody needs the medication help, we want to get them to that much quicker. And so with the psychiatric nurse practitioner or the psychiatric provider being on staff with us, they then can recommend those medications, and your PCP can go forward and actually prescribe them right then and there. So now that 3 to 4 months might be 3 to 4 days before you have medication to help you.
And all of this is covered by insurance, right?
Yes. Mm-hmm.
So, I mean, whatever primary care practice insurance they're covering or you have and you're able to go into, your behavioral health piece is covered by that.
Yes, so if your PCP takes your insurance, we take that insurance as well because the PCP is guiding the treatment.
And you only have to pay one copay. It wouldn't be multiple ones,
Yeah,
right?
it would depend on the day when you're coming in. You would pay a copay to see us, but absolutely it would just be one to see us, one to see your PCP.
Nice. Nice.
Mm-hmm.
I guess as we wind down this first segment here, one of the things I would like to ask is, how do we start that conversation, right? How does, and obviously there's some training from you to the primary care physician to really open up and have those conversations, those intentional conversations with the patients.
Yes, and I think we utilize that trust, right? So we will let the PCPs know, and they will tell us about their patient panel. And then we go forward with, here's some talking points, but also just the genuine connection that you already have with your patients to say, I truly do believe that this might be tied into some of your emotional processing or the day-to-day stressors that you're living in. Why don't we give this a try? There's outcomes that show, and I will work with this person. And so we can guide both sides of the treatment and see what's coming together to work.
Nice.
No longer two separate providers.
No, and you know what's interesting is, we're coming off this pandemic, COVID, and, so many people embraced telehealth, and I would imagine Evolve did as well.
Absolutely.
And, there's nothing like seeing the patient in their environment, right? Because, when you see them in an exam room, lots of these primary care physicians have lots of patients to see, and, I don't know what the average is, 7 minutes, 10 minutes, however long that is. When you can get inside their home and see how they're living and get a sense of, what those conditions are like.
Yeah, it's, there's benefits to both. I believe in having in-person care because it's good to make that genuine connection, and then we can read body language. We can see how someone's taking care of themselves, right? Telehealth is amazing because it does break down those barriers of access to care. If you can't get there on a regular basis, or if the setting up of a car service or a ride or someone to take you to therapy is one of the things that causes you a lot of stress, by the time you get to us, you're already elevated in your stress levels.
Right.
So we really leave it to the patient to let us know what is going to be the best care for you. But as a clinician, I will tell you myself, I do like to put eyes on my patient right there with me for the first session to get through, tell me about who you are and what's making you show up today.
Well, I think that there's no better way to do that. I mean, when you can physically see somebody, that makes the biggest difference.
The connection.
Oh, yeah. But I mean, still to be able to see somebody in their home environment is so critical.
We're not going to create barriers, right, Bob? That's the thing. We're going to remove barriers. We want these people to get the care that they need.
100%. Well, you hear the music.
I do.
I knew you would hear the music. Who. James told me you would hear the music, and he's taking us out with a little bit of Who, so I really appreciate that. I've got Rebecca Duffy here. She's the clinical director, right?
Clinical director.
Right, and I know the territory's expanded a little bit more, and we'll talk a little bit about that with Evolved MD. Down one segment. We got 3 more to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. If you're just tuning in, we're in our second segment. I'm your host, Bob Roth, and I have got Rebecca Duffy here in the studio with me. She's the clinical director for Evolved MD. And if you missed that first segment, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. You'll catch the one we did last year. We'll have to set it up for next March too.
That'd be really fun.
That would definitely be a lot of
here.
fun. So for those listeners that missed the first segment, we talked a lot about data, statistics, 1 in 4, and we talked about how Evolved MD really integrates within primary care physician practices, and on top of which, you guys are connected to a lot of really large health systems right here in our backyard. And I think about data, and correct me if I'm wrong, 50 states, right? The U.S.
Yep.
Do we really rank 49th?
Oof, I don't know if we've moved as of 2024.
Because I remember 23, we were 49th, and I was like, darn it.
We did.
I didn't want to be 50th, that's for sure. But
we lingered right at the bottom last year. I know that.
Yeah, and we do have a major issue here, and so much of the funding for these programs that we have is coming from the state. And I got to tell you, Rebecca, I'm not connected very solidly down in the state, but I've got dotted lines down there, and I know what's going on. I mean, we got about a $1.7 billion deficit.
Yes.
And Access, is dealing with the major issues there with funding. And, these programs aren't quite getting the funding that they really need. And that's really sad.
It is really sad. And, Bob, with that being said, we've only seen healthcare prices go up. So state of Arizona is the 15th most expensive state for mental health care across the U.S. So, again, we see people that we put that barrier there, right, as a state. We see people that might be seeking this. They may know that they want it, right? They've worked through the stigma. They've worked through the part of them that feels like, oh, I don't know about this. It might be hard. I don't know what I want to talk about. And they're ready to go. And then they see the price tag on that. And they can't. They simply cannot. And I think that's a failure.
No
right?
doubt.
When somebody is ready to work through some things that, could, as a proven statistic, help them to live longer, but also to connect with themselves to live a fulfilling life as they move through their age, right? And I know at some point we are going to talk about the increase of suicide in the elderly population. And, we see these things where compounded traumas, right? People have not worked through things for many, many years. And then again, they're ready to work through it and they can't.
Right.
Cost is not something that we can remove for some of these patients.
Well, we can't remove it, but I mean, I think your business model, and I don't know how, I forget, how long has Evolve been around?
Going into our 8th year.
All right, so I mean, your business model to integrate within primary care.
Yes.
I mean, obviously, maybe you can walk us through. There's some training that has to take place within the primary care practice, and it's not just with the physician. I mean, let's face it. I mean, we have older adults that are living home alone,
right?
And they don't have any interaction with people. A lot of these primary care physicians, their front desk people know maybe their patients better than the doctor does.
100%.
So there's training with the front desk people, there's training with the MAs, there's training. So can you walk us through some of that and what that looks like?
Absolutely, yeah. When we go in to implement a behavioral health manager right into a practice, we do a training, as you said, Bob, with everyone that works at that practice. As many people as we can get in front of, we will. And so I agree with you. For example, we do screenings for anxiety and depression, and oftentimes those will land in, say, a medical assistant's hands, and they will get a lot of information about these patients for us because they've known them for a long time. And you're right, the front desk folks that work up there, they know their patients well enough that if somebody comes in looking disheveled, they can know right then and there what's happening, what's going on, right? And then, the other part of it with these practices that's beautiful is we help them to believe in the model because they see the things that aren't working. They see them right there in that office. So again, as we spoke about, removing that access to care by taking the insurance right off the bat. Your PCP is leading this treatment. So with that being said, we're now all collaborating. It's a medical code. So your copay to see your PCP 95% of the time is the same copay to see one of our behavioral health managers. We're talking about a licensed clinician in Arizona, right? Going out on their own, potentially $150 up to $300 an appointment for the trainings that we're giving, and you might be paying a $25 to $50 copay to see one of our behavioral health managers right there at your PCP office.
Makes so much sense.
Right, doesn't it?
It really does. And I mean, obviously, the training is so important, and it's the questions to ask. The things to see. I mean, obviously, observing, somebody disheveled, maybe some bruising, maybe, whatever is going on, is seeing is being able to say something, but also to ask the right questions because sometimes you can't see it on the exterior.
Agreed.
It's going on in the interior.
And that's what's amazing with working directly with the primary care provider, with a medical physician, because if you don't see it on the outside, oftentimes we can start to see it with data from the inside, right? So as someone's health is deteriorating or something is continuing to be a problem, medication management, A1C control, right, blood pressure issues, we can now start to take that and say, well, what is that linked to? If you know that the medication is going to help, why don't you take it? If you know that lowering your sugars is going to help your overall lifespan, what can we do to help you maintain those? What can we do to help you get into daily habits? So not only do we have this access to say, I see you, my friend, that's been coming in here for 10, 20 years, but also these numbers are not getting better, or your feeling about your health is not getting better. Let me walk you across the hallway and let's start to see if we can help improve that from another lens.
Right. And to that point, I mean, so many people hear what the doctor says, but don't follow through what they say, and I look, I'm kind of putting you on the spot, but I would think that if they're advising that person to go over and meet with one of your behavioral folks, then we're, talking about somebody that might hold them a little more accountable.
Yes,
because the primary care physician, can't do it like the behavioral health manager can.
Right, and the patient already trusts someone,
Right.
right? So we know one of the statistics is right around 60% that if you leave with a referral card for mental health from your doctor, right, and you didn't have a behavioral health manager right there in the office, you will not follow up. And Bob, I'll be honest with you, when I go in front of those big healthcare providers, those PCP offices, I often tell people I'm a therapist myself, but I'm a busy woman and I have a child and I'm doing a lot of things. And I would know that it was right what my primary care was telling me. I would know that I needed to leave and I needed to take care of myself. I'll give everybody else the best advice. Don't pour from an empty cup. Would I prioritize that? Probably not for a little while.
Right.
And one of the things that's also beautiful about our model is we have another support service within the model, our care coordination team, that will reach out to me and tell me who takes my insurance, where can we go for external issues, things we need outside of that primary care office, or get me set up right there and make sure I'm going back to my primary care appointments.
Right.
So it's that accountability from the behavioral health manager, it's the accountability from the PCP, but it's also having somebody assist in all the other red tape that brings us down. Right? It brings us down. Adulting can be hard on a regular basis.
Yeah, it can.
Right? And so you forget to prioritize what is really important. We're trying to eliminate that.
No, for sure. So as we come up on the break for the halftime, how do people get a hold of you guys?
So you'll go in to see your PCP. They're going to do some assessments, talk about what we do within that office, and refer you right over. They actually don't even have to fill out additional paperwork. They just put you on our behavioral health manager's schedule.
So I do know this. Not everybody has a PCP. Not everybody goes and gets their annual exam.
Sure.
Is there, if they go out to your website,
Yes.
and that is evolved MD, EVOLVED, MD.com, right?
Yes, you got it.
And can they see where you guys are located?
You'll see partners on there. Absolutely.
Yeah. I mean, look, this is really important, guys. 1 in 4 has a behavioral health issue. And you said it in the first segment, 50% are not getting treatment.
Right.
Not getting treated.
Right.
You're listening to Health Futures, Taking Stock in You. It's halftime here. Stick around. I got Rebecca Duffy here in the studio. She is the clinical director, if I would.
Yeah,
Evolved MD. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second half here. I've got Rebecca Duffy here. She's the clinical director for Evolved MD. And if you missed our first half, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So, Rebecca, what's interesting to me is here we are in the middle of March, and it was exactly 4 years ago, almost to the day, that the world shut down.
Yes.
I mean, it's something that we all would like to forget about. I mean, human behaviors were all over the place, and it brought out some of the worst.
Right.
And it did bring out some of the best, but the worst was so devastating to see. And whether it be, at Costco, because I was there but missed it, where the police were there because people were fighting over toilet paper, to the anti-vax people, to the political discourse that was happening.
Right.
I mean, it brought out the worst in humanity. It really did.
It did.
And you know, the crazy thing about it was so contentious, and at the same time, it was scary. And for older adults, they were already dealing with one of the biggest issues that involves them, and that is social isolation. We have 1/3 of our population, 65 and older, that lives home alone. And according to Dr. Joseph Coughlin from the MIT Age Lab, he says between 2040 and 2050, that's going to push about 50%.
Right.
And during COVID, they were already alone. Now you told them they couldn't leave the room,
Right.
and nobody could come into the room. Wow, that had to just, make the whole behavioral health. I mean, that's probably why we went from 1 in 5 to 1 in 4. I mean, had to be.
Believe that. I believe that for sure.
I do.
Yeah.
So, talk to me about social isolation, and especially with older adults. What are we doing to improve that?
So I think too, I mean, let's set up the scene, right, Bob? These are folks that maybe have lost a partner recently. They've lost some of their own autonomy, right? Then potentially that autonomy, the loss of that autonomy. So say an in-home healthcare worker, maybe they're not coming as often. Maybe they're not even seeing those folks. We've now eliminated friendship circles. We've eliminated being out in the world. That kind of isolation would get to somebody within a couple of days. There are only so many things we can do to entertain ourselves. And then let's be honest, some of those things, watching TV, screen time, being on the computer, those actually lead to increases of a lack of productivity and increases in depression. Being outside and interacting with people is one of the things that we need, right? Hierarchy of needs. Being with people, being loved, being nurtured is very important to our soul. And so during COVID, the isolation really led our elderly population down a very dark road. And I think the only maybe kind of good thing that came out of that is it did start to eliminate some of that pressure, some of that stigma on mental health. It brought some things forward because folks that never had dealt with mental health were now extremely anxious, extremely isolated, and extremely depressed. And so it opened up a door for folks like in the elderly population, right, that did have that stigma attached, right? You spoke about, your grandmother and what she had told you when you were younger. These are folks that maybe didn't have as much belief in the mental health side of healthcare, and now they're noticing, okay, I need more. And so we have seen more of our geriatric and elderly population coming in and utilizing therapeutic services, but it still needs to increase.
We talked about self-medication, and, I know this just from the clients that we serve. And, when our social isolation happens, depression is happening. And so if they're not getting, prescription medication from a licensed professional, sometimes they take it upon themselves. The hardest thing we deal with is so many of our clients, so many of our elderly are taking a lot of different medications.
Right.
And, one of the big ones that they take is blood pressure medication, right? And, you take that and you mix that with alcohol or other drugs. It can wreak havoc. I mean, we're talking the biggest thing that puts people in hospitals are falls. And you start mixing alcohol with that, falls are going to be more prevalent than they ever have been before.
Right. And then think of, so we see that and that taking course of action, and say then that person does have a fall. Now we're isolated again because during COVID we're in the hospital, which is terrible, but then also we're in our own home, we're alone, we don't feel well, we are potentially dealing with a loss recently of a partner. The whole thing is a snowball effect. And that's what Evolved MD really wants to do, is stop cycles. Stop medication management or A1C or these self-medicating, self-soothing cycles at the end of the day. And yes, you're right. We do see with the elderly population, any kind of mixing of, medications in general, right? And not monitoring those, that you bring alcohol or any other drug into this, and we're already dealing with an extremely dangerous cocktail of things in one's body. So,
I really do like the model. I mean, when you really think about it, it really is an integrated healthcare model.
Right.
And it gives those practices the ability to not just treat the patient physically, but gives them to treat, the whole body, the mind, body, and spirit. One of the things, and we can start here, and we'll probably maybe get into it into the last segment. It's hard to believe we're almost 3 down.
I know.
But suicides. And suicide amongst, I think it's bigger on males than it is females, right? Or
yes, elderly males.
Yeah, elderly males. I mean, what is going on? What's causing this?
Yeah, so I mean, we have some stats on that too, Bob. In November, the Centers of Disease Control and Prevention, they showed suicide among elderly people, specifically older males, has seen a steep increase. And I think what that's due to is, again, this isolation we're talking about, right? And then just loneliness in general. Again, and I've said this a few times, and having, I recently have seen one of my parents go through this. You lose a partner that you've had for 35 or 40 years, if not more. Your whole life has been built around that, right? These are marriages that were happening in, the 70s, the 60s, and things were different at that point. Now you've lived your life through all of these changes, and the person that's gone through those things with you is now not with you. That is an extreme grief process, and we really, as a nation, we don't give grief enough attention because we often think grief, and I often say I have a hard time with our diagnostic manual as a therapist because it still hones on you grieve something that you've lost. You grieve a person. You can grieve your loss of autonomy for years, your loss of running your own life for years. And I know we're going to talk a little bit more about that in the fourth segment.
Right. No doubt. I mean, the fact of the matter is that loss is a big thing.
Right.
I don't know if you know Dr. Pauline Boss and ambiguous loss, and I served on the board at Duet, and
That's amazing.
And we're running this one program right now called the Meaning and Hope Institute, trying to help people with this ambiguous loss.
Right.
It's really, really hard.
It is, and there's a lot of gray area. Grief is very deep. It is very different than what we have thought it to be in years prior.
But I'll tell you what, as we close this segment, the stigma is now getting lifted. I mean, it's okay to talk about this. I mean, and people that are in public positions, more and more are coming out and talking about this,
Right.
and it's becoming more acceptable.
And it's normalized. It's
It
beginning
is
to be more
normalized.
normalized.
And
Absolutely.
their treatments, right?
Yes, absolutely.
Yeah, there's definitely a light at the end of the tunnel.
Yes.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We are down 3 segments. I got Rebecca Duffy here. She's the clinical director from Evolved MD. We got one more segment to go. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. And if you're just tuning in, we're in our 4th segment here. I got Rebecca Duffy here in the studio with me. She's the clinical director for Evolved MD. They are a behavioral health group that is integrated into primary care practices all across the valley and more. You're like in New Mexico.
Right, New Mexico, Colorado, Utah.
And Utah. Wow. You guys are like taking over the whole Southwest.
That's the plan. We're going to keep moving.
And what's next?
It's hard to say.
Are you going to
Bob.
go to California?
It's hard to say.
My concern if you go to California, you're going to probably suck up all your resources because there's definitely a lot of behaviors that are going on.
We seek the states that have the most need, right? Yeah. And so we are constantly looking at various states, various partners, and seeing where we can go next to make sure that this model is given the right chance.
Well, no, it's really important. And everyone that's listening, please, 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 if you want, catch our first 3 segments. Catch it up on our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So, we've talked about a lot of different things, and we've talked about how people can find you, evolvedmd.com. But more importantly, it's really important to get in to see your primary care physician. And I'm telling you, health plans, especially the Medicare Advantage plans and the supplemental plans, one of the things they struggle with is that, people are buying these plans and they're paying for them, but they don't know what they're dealing with because no one's going in to see their doctor.
Right, absolutely.
It's really important too. And for our listeners, maybe we can start with that, how important it is to go in and see your PCP.
Sure. If we don't, in life, what keeps us stressed are the things that we don't deal with, right? And at the end of the day, Bob, you and I both know, we know when there's something wrong. We don't want to admit it to ourselves. That's the first problem. Right. So if you can get over the hump of actually getting in to see your doctor and say, okay, I'm open. I know that there's something wrong. And best case scenario is you get in there because you're doing preventative items. The doctor becomes scary because you've gone in probably a little late. You haven't kept up on something, and now we've got a bigger issue. Nothing really stays small once you hit a certain age, right?
Right.
If something doesn't feel right, you don't go in when it's really painful. You go in when it starts. Otherwise, you're going to deal with something worse.
You got to listen to your body.
Absolutely.
It's a wonderful machine.
Yeah, and it
talks
knows.
to you.
It knows.
It knows, and it talks to you.
And I think that's one of the incredible things
My
about
shoulder was talking to me this morning.
right?
So.
My neck talks to me after, by a Friday afternoon, sitting here thinking, what did I do this week to be stressed? Your body's going to show you exactly what you aren't doing well.
Right.
Get to the doctor. The doctor's less scary if you don't go in every time hearing bad news because you're doing something preventative.
100%. No, and that's really important, is for us to be mindful of that and certainly taking inventory. Right.
Right. I mean, you know yourself the best. If
Right.
you go to bed at night and you are thinking about something continuously, I'd say that's probably the thing that's causing you to not only feel well mentally, but also physically on some level.
One of the things we talked about at the break is employee happiness. And, I saw a stat the other day, and I don't know if you have it. Maybe you have it, Lindsay, but, it was like a year or two ago, 40%, I think was the number I saw, of employees were unhappy, and they were thinking about leaving their job in the next year. And now the number's like 75%. And I'm talking about C-suite people. I'm not talking about anyone else. I mean, I get these LinkedIn stories, and
Right.
and I think it was in Time magazine or something. They were talking about how devastating this is. People are not happy with where they're working.
Right. I think they're calling it, we talked about earlier, the great gloom instead of the great depression. I've also heard the great resignation. I think what we see in today's society is A, the need for immediate gratification, and B, the lack of balance. And that's something, again, I love the company that I work for, but if you are overworked and you are burnt out and you recognize that you see your coworkers much more than you see your partner or your children, we're in a serious problem, right? That's a deficit of happiness at that point. My dad used to say, he'd ask me, how was work? And I'd say, it was work. And he'd say, well, if it was fun, they'd call it fun, right? Like, you don't get to go to work in the United States and feel like you're making a difference if what you're doing is being bogged down. And by the end of the day, you're emotionally and physically exhausted. And so that balance is really important. And I'll tell you, Bob, I worked in mental health care now for, I think, 15 or 16 years. And Evolved MD really is a wellness-based practice. I mean, we really tell our people, we can't go out and treat patients in their stress and anxiety if we don't feel well enough ourselves to do so.
100%.
Right.
And what's interesting is, look, anybody can go work.
Sure.
More people need to, by the way. There's a lot of people that don't, and we won't go there right now. But when you choose your profession, and I talk to a lot of young people, and I've been given the honor to talk to some ASU students because I sit on the HEAL Lab, the Healthcare Entrepreneur Accelerator Lab, which is part of the ASU Innovation School of Nursing.
Yes.
And I see these students and I talk about it, and I'm like, if you do what you love, you never work a day in your life.
Absolutely
And you have to really be passionate about something you choose. And I think that leads to happiness, is seeing the fruits of your labor really making a difference in the person's life or whatever product or service that you're providing.
I couldn't agree more. I mean, I think for me, one of the reasons of getting into counseling in general is they say, be the person you needed when you were younger. And I know that there are many people my age that could have utilized additional support at any point in their upbringing. I also think, choosing people, right? Like I tell my employees, I tell everybody that I work with, my supervisees, you chose people. You didn't choose widgets. So we're not stable. It's not the same every day, but you get to see improvements. I always say, put your wins in your back pocket, because some days the wins are harder to find, but you've made a lasting impact on someone's life, the way that what they're grateful for, how they're going to live out the rest of their years because of maybe, 12 hours you spent with them. That's an amazing feat.
It is. But what makes it really hard is that because of what we went through with the pandemic, more and more offices are working, people are working remotely. People are working from their homes. They're working from Starbucks. They're working from wherever. So you don't have that interaction with the employer, employee, or manager and subordinate like you used to have. So,
True.
So as a business owner and one that manages over 100 people, I mean, it's really important for you to be able to be intentional with your visits and be able to connect with them, but figuring out ways to communicate with them when you can't be in front of them, right?
I think you said my favorite word of that, Bob, is being intentional, right? We are robotic as a population. We drive to work. We don't even remember driving there. We get to work. We
That
don't
happens
remember
to you
driving
too?
home. Absolutely.
Happens to me.
And I think being intentional, being mindful, right, is something, and that's part of counseling practices on a regular basis anyways, but being intentional about your happiness, whether it be at work, whether it be at home, what changes can you control?
Right.
We get caught up in something that is unrealistic with all of the social media, with all of the reality television shows. That is not real for a massive majority. What can you control on a daily basis? What can you be intentional about? You can start with the smallest thing. It is amazing how much, for me, I love coffee, so I have to really drink water, and I do physically feel better. I can see that tiny change.
Mm-hmm.
It's not a huge commitment. I'm not telling you need to go work out at the gym for 15 hours a week. I'm just drinking another bottle of water.
Right. No.
Small change. What can you be intentional about?
Right. And for those employers out there or managers to employees, it's really important for us to think about how do we be intentional, how we be mindful, how we connect with the people that we work with, because a lot of them, I mean, we talk about, the stressors that are happening and the fact that we have 1 in 4 people having a behavioral health condition, and many of them are depression. And a lot of it leads to the fact that they're not communicating in the way that they used to. I mean, this to me, and I'm holding up my device, my Apple phone, is one of the greatest inventions of our time. It's also one of the greatest deficits of our time. I mean, this is an energy sucker.
Right.
And one of the challenges I deal with is people are communicating via text, emails.
Right, we don't even hear people's voices anymore.
Well, we don't, and it's not a dialogue; it's a monologue,
right.
And it's an echo chamber. So we have to promote ways that we can have a dialogue and have meaningful, intentional discussions.
And if it's not at work, if you can have them at work, that's great. If it's not at work, make sure that you're intentional after work to connect with people that give you energy.
Wow, there's no better way to leave off this conversation. Rebecca Duffy, it is so wonderful to have you here in the studio again.
Thank you so much for having me back, Bob.
We'll have to,
anytime.
We'll have to block off next year, same time.
Yes, St. Patrick's Day.
There you go. Make it a great day. Have a great weekend.
Thank you.
And we'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.